Hello and welcome to another episode of the Alter Your Health podcast live. We are live and welcome. Welcome one, welcome all. This is your source of information and inspiration to promote the holistic transformation of your health and the health of our planet. And I'm Dr. Benjamin Alter.
I'm Dr. Susanna Alter.
And we're excited to be with you here today. And before we dive into this episode, where we are going to be talking all about chronic, mysterious joint pain and understanding really what the heck is going on, which is really important. That's the first step we need to take in order to heal, understanding what is happening in our bodies. But before we dive in today, we want to make a little plug. This episode is brought to you by Alter Health. And specifically, we are promoting our course, which we are so excited to be offering. It is officially launched. It is the Medicinal Living course, and we've got a coupon code specifically for you. If you are tuning in to this episode, the code is Alter Your Health, and you will receive 20% off lifetime access to this transformative, experiential, educational course on medicinal living.
We poured our heart and soul into creating this course and are very excited to get it out there to you all.
Yes. In this course, we cover all things related to nutrition. We spend 3 weeks really diving deep into nutritional science, understanding exactly what foods are the most healing to the body, why these foods are the most healing to the body, and how to incorporate and implement a healing diet into your specific life, because we know that, change can be difficult. So we've got action steps that are specifically designed to guide you along the way in this healing journey. And in addition to food, we talk about things like hydration and water, how to optimally create deep cellular hydration, which so many people are chronically dehydrated, especially when we look at the specific cellular hydration, and really what that comes down to is mineral balancing. And we also talk about breath and how to modulate breath and also control the air that we're breathing, our environment, and how important that is for our health. And we also talk about mindset and essential medicines of the mind is the sixth module. And so, this course is broken into 6 weeks. Each week, we dive deeper into the fundamental determinants of health, the essential medicines that we need to master in order to truly heal. It's really the only way to truly heal. We're not, there's no band-aids that are given out in this course. This is true healing.
Yeah. And you might think that you're getting all of this information through listening to our podcast. And it's true. We provide a ton of great information through these podcasts, but you may find it hard to really pull it all together unless, I don't know, maybe you start at episode 0 and then listen through. But even then, this course we really had the intention of really creating a strong structure, a step-by-step process for the students so that they can really create a strong foundation of health. And how we feel about this course is that if you are to put your 100% effort into taking this course and following all the action steps, there's no option but to experience a deep health transformation.
It's true. And let's dive into some more transformative information in this conversation on this specific episode number 123 of the Alter Your Health podcast. But wait, did we give the coupon code?
Yeah, coupon code.
Reminder, just if you blinked like I just did, the coupon code to receive 20% off of this course is Alter Your Health. And go to www.alter.health/course and you will access more information about medicinal living. And remember to use that code Alter Your Health to get 20% off. So we hope you enjoy that. And let us know if you have any other questions about it. So now we are on to mysterious chronic joint pain, which Dr. Susanna has some personal experience with. Me, not so much personally. So maybe, do you want to just lead us off by sharing what we're really talking about when we're using this term chronic mysterious joint pain?
Yeah. Well, this topic came up for us to talk about this week because we recently learned about, I was recently having a conversation with someone about this mysterious joint pain. And what we mean by that is, chronic pain, and They go through all these tests, blood tests and imaging, and everything
All
comes back normal.
the autoimmune antibodies, rheumatoid factor, and all of the other things that could be elevated.
And it all comes back normal. And many times doctors kind of scratch their head at this and say, well, okay, we're still going to treat you as though this is an autoimmune response happening in the body.
Which just to pause there, which just goes to show you that the whole autoimmune phenomenon is so poorly understood. It's very nebulous. There's so much gray area. So a lot of the symptoms that someone experiences, it's like, oh, I don't know what's going on, but, let's just throw it into that pile of symptoms and treat it as if it were an autoimmune condition. And yeah, some people have some relief of their symptoms for some period of time, other people not. But,
exactly. Yeah. And so this really struck a chord with me because I did experience this. Joint pain was really the first symptom to come on for me in my chronic illness experience. And like so many people, I went through all the pokes and images and
like blood draws.
Yeah, blood draws. And I felt like a lab rat. And they weren't able to find anything that was abnormal in my blood. Nothing. It was all completely normal. And when they examined my joints, they looked at it and said, well, there's no inflammation, there's no discoloration, no deformity. Everything looks normal.
Yeah. And I'm sure on some hand, it's like, okay, great. Like there's nothing crazy wrong with me. But on the other hand, it's like, well, what is going on? Why do I have joint pain? If nothing's wrong, then why am I suffering over here?
Exactly. And I was fortunate enough that the only medications I was prescribed were NSAIDs, so non-steroidal anti-inflammatory medications, but oftentimes people are given long doses of steroids,
methotrexate, other sort of chemotherapeutic drugs, and immunosuppressants.
Exactly. And these are some really toxic drugs. And, they all have their purpose, but if we don't understand what the cause of this mysterious joint pain is, then it's almost like we're just kind of like throwing, what's the analogy? It's like
fishing with dynamite. I don't know.
It's like you're throwing darts blindfolded. You're like trying, I don't know. You're trying to pin the tail on a donkey or something.
I like fishing with dynamite. Even though maybe fishing with dynamite, at least you get some fish. Well, I don't know. But yeah, we don't want to fish with even a fishing hook and fishing pole. But anyway.
And I also want to say, I think what often comes up for people, I know it did for me, is that when you reach a point in this medical investigation where you've done all the tests, everything is normal, but you still feel very, very sick, you start to feel really hopeless. You start to feel like, oh, this is going to be my future. This is the rest of my life. I'm going to have to learn how to manage these symptoms and live with these symptoms. And it was just kind of the luck of the draw that I'm a sick person.
And in your experience, Susanna, did the non-steroidal anti-inflammatory drugs, the NSAIDs, did they help you?
No, they didn't.
Okay, so you're still suffering, still receiving poor treatment. And
but at the same time, I was afraid to stop taking them.
Yeah, because I'm sure they were, you were experiencing pain, but maybe you had the thought like, oh, well, maybe I would be even worse if I didn't have this level of medical intervention.
Yeah.
And yeah, I think that I'm sure you were trusting your doctors, and I think that it's okay to trust your doctors, knowing that they're doing their best, but also knowing that the best that they are doing is sometimes not good enough. It's just, there are so many holes. And when we're talking about any chronic illness, that's really where the holes in conventional understanding exist, especially when we're talking about chronic mysterious illnesses that, like in your experience, Susanna, there weren't any definitive laboratory tests that said what the heck was going on. And there really aren't definitive laboratory tests for most things other than, like cholesterol and like anemia, and these very basic blood tests are reliable and we can get some good information on. And also, other kind of more vague like inflammatory markers and those sort of things can give good information. And I'm sure if you were, I'm sure they, tested your inflammatory markers and saw that there were systemic inflammation going on, but still it's like, it's like there's smoke, but where's the fire? And so understanding exactly what is the root cause of the symptom, once again, is really important. And I think that a lot of natural health practitioners are aiming to identify and treat the root cause of the symptom, but maybe it's not the true root cause, So let's talk about the true root cause of some chronic mysterious joint pain.
Great. And there are kind of two understandings. So I will kind of tease apart the two understandings. But first, just want to acknowledge that, there are forms of arthritis that are more diagnosable, like osteoarthritis, rheumatoid arthritis, juvenile rheumatoid arthritis, all of these things that, there are more systematic ways to diagnose. And that's not really what we're talking about. One understanding, which is more based in science, is the understanding of cross-reactivity, or molecular biomimicry is the other name for that. And so with this understanding, there is often really what's happening is that the disease process is starting in the digestive tract. And so you see many people with chronic joint pain also have some issues with their digestive health. And what happens when the cells of our gut lining become inflamed, they also start to create a larger gap between the two of them. And this phenomenon may be called leaky gut or hyperpermeability of the gut lining. And what happens when when the gapping between the cells gets larger is that there is now a passageway for large molecules to move from the intestines into the bloodstream that otherwise wouldn't be able to move across without those big gaps. And that can mount an immune response in the body. So your white blood cells, your antibodies, are going to recognize this foreign molecule as a foreign invader, and they're going to attack that molecule. But what can happen is that they can also confuse that molecule with other molecules that make up your tissues. So for example, let's say there's a molecule that looks really similar to the molecules that make up your cartilage and your joints. The antibodies are going to attack that large molecule, but then they're also going to turn to your joints and say, oh, that looks very similar. We're going to attack that as well. And that is the more kind of autoimmune-based molecular mimicry theory. And based off of that theory, the way to heal that chronic joint pain is to heal the gut.
What's the other theory?
The other theory is that there are some underlying chronic infections happening. And some of these, as we become exposed to certain viruses, things like Epstein-Barr virus or the herpes family viruses, our own unique body can respond to these, or we have different susceptibilities. So for some people like me, when I start to have a more weakened immune response, I feel it immediately in my joints. For other people, they might experience it with migraines. And for some people, there's just more viral activity happening around their joints, more of those kind of viral endotoxins actually impacting and causing inflammation around the joints.
Mm-hmm.
So then through this theory, the approach to heal the joint pain is really to boost your immune response against these foreign invaders.
So can I chime in?
Yes.
Okay. So based on these two theories, it's like one is that there's gastrointestinal inflammation. The other is that there's some sort of hidden pathogen. One is that you heal the gastrointestinal tract, the treatment therefore, and then the treatment of the chronic infection is that you boost the immune system. So if I'm understanding these two theories, I'm kind of thinking like, well, why can't we just do both of those treatments? Like, why can't we do both?
Exactly. So that's why it's almost like, okay, whether it is this one or that one,
you want to heal the gut and you want to boost the immune system. That is attacking things, so to speak, from both angles.
Yes, and they come hand in hand.
And they come hand in hand. It's not like you can really truly have super immune boosting activity without a healthy gut. And it's not like you can have a really a diet. We're talking about food. It's not like you can eat a really gut healing diet that isn't also going to support the immune system. So they do very much go hand in hand, these two approaches.
Exactly.
So it's kind of like, the way I think, because I love science. I love how we can have such a great understanding of so many things. And I also recognize that science is inherently incomplete. And the reason why science exists is because we are trying our best to discover some unknowns, and there will always be unknowns. So, on one hand, it's like, great, we have some understanding of what's going on. On the other hand, it's like, we kind of have no clue. So let's just do all we can to embrace the vitality of a healing gastrointestinal system, a healing human being. Let's boost the immune system. And the way that I see it, it's like, this is the way to move, regardless of whether or not there is joint pain. This is the way to nourish our bodies, even if we have a tummy ache and it's just localized to that, or even if we have headaches, or even if we just have a cold or a flu. Or even if we're feeling really good and we just want to keep it that way and want to extend the life in our years. So that, it's like, cool. All right, we're quote unquote treating the chronic mysterious joint pain, and we're also promoting health, because we don't really, you and me, Susanna, like, we don't really treat disease. We support people in healing. We are not treating disease. So when someone is coming to us who is suffering with chronic joint pain, we're supporting their bodies in healing. We're not treating the joint pain. We're supporting a human being. So I think that is an important kind of philosophical thing to understand. And once again, we go into much deeper into that in our medicinal living course. Yeah. So what else do we want to say about joint pain?
Yeah. Well, just to echo with one more sentence, it's like when we really address the foundations of health, all of the symptoms resolve in the process. It's not like we are targeting the joint pain with fancy protocols and fancy products and things like that. We're really supporting the body's ability to heal itself.
Yeah. That being said, I think it would be cool to spend 2 or 3 minutes on kind of symptomatic treatment, addressing the symptoms.
Yes,
addressing the symptoms, because we do want to address the symptoms throughout the healing process. And there are some ways to address the symptoms.
Yeah.
And, the first thing that is probably the most popular word in holistic health is anti-inflammatory. And anti-inflammatory and antioxidant, those are two of the most popular words. And we think about, some popular herbs as having potent anti-inflammatory effects. And also, and the most powerful anti-inflammatory medication is going to be removing the sources of inflammation, which are by and large nutritionally. So when we remove the sources of inflammation
in the diet,
to be clear, and these are meat, dairy, and eggs, really the biggest inflammatory sources. Obviously, some meat sources are more inflammatory than others, but by and large, these foods are difficult to digest. They cause systemic irritation in the gut, and they also promote inflammation systemically in the body.
And also, to add to that list, GMO corn, GMO soy, conventionally grown wheat. All these products that have been sprayed with a high level of herbicides and pesticides are also very inflammatory to the body.
Yeah, they contain
sugar, canola. The list goes on.
They contain, essentially just, foods and food-like substances that the human body is not designed to metabolize, to digest, to break down. They're not healing foods. So removing the inflammatory foods and putting in some really potent anti-inflammatory foods like turmeric and ginger and other herbs and spices. When we think about herbs and spices in our cooking, obviously they're going to add flavor, but they're also going to be a high concentration of anti-inflammatory compounds. And even things like green leafy vegetables and beets and cucumbers and celery and radishes.
Fruits and veggies.
And the list goes on and on. All of these things are really potent anti-inflammatories. Pineapple. Pineapple specifically has an enzyme in there that is really good at, breaking things down in the body in an anti-inflammatory sort of way.
Bromelain, but you need to eat the core of the pineapple.
The core of the pineapple. And so anti-inflammatory kind of boost. And then the other thing I think about in terms of symptomatic management of
but what's interesting is that shifting to that diet is not just symptom management. You're talking about foundational pieces of health.
Yeah, thank you for, it's like these addressing inflammation is going to help manage symptoms, and in a way that is non-suppressive. It's not like we're putting a Band-Aid on in the form of a non-steroidal anti-inflammatory drug. We're not just suppressing the inflammation, synthetically.
Because we could also do that with herbs. We could suppress inflammation with herbs, like with white willow bark, which has the same compounds that they designed aspirin after in it. So there are ways to suppress symptoms naturally, and that's not what we are all about here.
I mean, it doesn't work that well. We like healing, and healing really only happens when we remove the obstacles that are preventing the body from naturally healing itself. And then, another thing I think about in terms of symptom management, and once again, symptom management in a way that is restorative and regenerative and supports the body in healing itself, is the application of hydrotherapy. Wrapping a joint in a cool, wet towel, and then wrapping that cool, wet towel with a warm sweater or scarf or blanket, that promotes localized circulation to that area, to that joint. And we know that where blood flows, energy goes, and where energy goes, healing happens. So these are some ways to just really boost localized healing in a specific joint or part of the body.
Yeah, and then also when we talk about joint health, I think another big buzzword right now is collagen supplements, which we have a whole episode on collagen and collagen supplements. So I definitely want to point you to that. But the big take home for supporting your own body's ability to heal and create more collagen is to supplement vitamin C. And we're not talking about isolated supplemental vitamin C in a capsule. We're talking about foods that are very high in vitamin C, like amla berry, like camu berry.
So go back to episode number 107 to listen to collagen restoration and regeneration without collagen supplements and without bone broth, because these things can actually be a lot of toxins introduced to the body. So we want to shift away from that and towards regenerative collagen in your body, biosynthesizing it.
Yes, and it's
Anything
like
else?
I could go down. We could then talk about gut health.
We're not going to in this conversation. We've talked at length about gut health in other episodes, but we want to shift your perspective. It's like joint pain, heal the joint pain. But we need to open up and see what the root cause is, which is both the immunological chronic suppression of the immune system and potential pathogens, as well as chronic irritation of the gut. So we want to open up and look beyond the joints at what's going on beneath the surface, because the joint is just the tip of the iceberg. So let's listen to those symptoms that are guiding us deeper to more regenerative, restorative health and healing of the body as a whole.
Yes, and I just want to also tell these people who are experiencing mysterious chronic joint pain that your body is still healing itself. Your body is doing everything it can in its power to heal itself, and we just need to identify what the obstacles are that are getting in the way of your body's ability to do what it does best, which is heal.
Piece of cake.
Without
the cake.
This is not a forever, life sentence of chronic joint pain for you. It's not just, oh, they couldn't figure out what caused my joint pain, so now I'm on this medication for the rest of my life. That kind of works, but not really.
Yeah. Oh boy.
So
Let's try not to talk anymore about it. It just like makes my skin crawl when I think about people being prescribed medications for a life sentence when they just work haphazardly while deteriorating the body. So anyway.
Okay, yeah. On that dark note.
On that dark note, your body is healing, and we can support it by, just nourishing it the way that nature intended. And if you want more information on how to implement these nourishing behaviors and habits and food choices and information and inspiration and guidance along the way, check out Medicinal Living. And once again, the coupon code to get 20% off exclusive for the podcast listeners is Alter Your Health. You can get 20% off of this life-changing course, and you can access the course and more information on it at www.alter.health/course.
Mm-hmm. And for those of you who are wondering, I have been joint pain free for like 5 or 6 years now. Keep forgetting the timeline, but
yeah,
proof that chronic mysterious joint pain does not have to stay forever.
Right.
So
nothing does. Nothing does.
Mm-hmm.
So thank you guys for tuning in, and we are sending you our love and blessings in your healing journey, and just sending all around good thoughts for the rest of your day and week ahead. We look forward to seeing you guys next week.
Bye-bye for now.
Peace and love.